Hi, Namaste, Dr. KMK Reddy. Today we will discuss another important issue in the cardiology. We know there is a lot of confusion and controversy and some amount of better understanding we need to have because of the inherited issues with this. That is, what is the difference between a cardiac arrest and the heart attack? This is being discussed because an important issue here is everybody knows the heart attack to some extent. And there is a lot of noise or a lot of talk and discussions going on in the media, social media and public domain, saying that somebody, a young guy who died of cardiac arrest recently and some other news similar to that. And people think that there is a confusion between the heart attack and the cardiac arrest. They are different entities, to tell you very frankly. Heart attack, we know that there is compromise of the blood supply to the muscle of the heart. Therefore, they are developing chest pain or a breathlessness or a giddiness or a collapse. Several manifestations like this leading on to some ECG changes. So that is something called a heart stroke or a heart attack. This is the difference. Suppose if somebody dies because of arrest, in the sense because of stoppage of the heartbeat, we call it as a cardiac arrest. You may ask me, then probably both are same. No. All heart attacks need not lead on to cardiac arrest. At the same time, all cardiac arrest also may not be an eventual story because of heart attack. I mean to say, when somebody's heart stops for a while or for permanently, it is called cardiac arrest. Say the cardiac arrest or the stoppage of the heart may be because of various reasons. One of the reasons is a heart stroke or a heart attack. At the same time, I also want to tell all heart attacks not necessarily lead to a cardiac arrest. Somebody may have a cardiac arrest and may get treatment and may completely recover after some period. Event happened because of the compromise in the blood supply to the heart. Therefore, there is a pain, everything happened, then they recovered, and the rest of the area which got involved for the heart attack probably will have some recovery, some amount of muscle maybe not recovering, and the life will be restored in these people with several treatment modalities. But if somebody's heart stops, that is called cardiac arrest. Cardiac is heart, arrest is arrest. So there is also confusion between heart failure and cardiac arrest. So again I am telling, the heart failure is something different. Heart failure means there is a compromised function of the heart. Let's say 100% is normal, probably less than that, like 40%, 50%, they may have compromise. I'm talking about from 100% level. If it compromises to 50%, then there is something called heart failure. Failure is something like it is not able to cope up the demands of the body. It is not able to pump enough that is required for the normal functioning of the organs in the body. That is a failing heart, we call it. So heart failure is something different. Even though there is an entity called a sudden heart failure, But normally heart failure is a long-standing process. So a failing heart is something, they will have some breathlessness or some chest pain, and they lead on little compromised life. It is something like a compromising the quality of life, they just pull on the life. So this is a heart failure. This pumping is defective, therefore they just lead on the life. So now the terms are very clear. Heart failure is a compromised heart, function is defective, so they just pull on years together, sometimes pull on even decades together. Quality of life will be compromised. That is the story with a heart failure, crudely speaking. Heart attack, somebody gets a chest pain or a breathlessness, most of the time suddenly, and that will be treated by standard modalities like doing an angiography or an angioplasty or medicines or surgery, something like that, and they recover, they lead on. Sometimes some people may end up with a heart failure because of the compromise in the function of the heart. And third event I am just describing is cardiac arrest. It is something like a cessation of the heartbeat. It's a terminal event in life. We need to have a clarity among this terminology to have some idea what is heart stroke, what is heart failure, what is cardiac arrest. Well, let us not go to the deeper parts of all those things to have more confusion. So the clear-cut difference for all these things is this. Thank you.